The advice and opinions expressed by Dr. Grandpichet and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
The next question that we have, my daughter is 15 years old. She has been quirky, but there was no language delay. So we didn't even consider autism. Now, though, we really are seeing how much she is struggling. She has total meltdowns when anything changes. She has siblings, but has never been able to have a good friend. Now, with hormones on board and school being different, she is having a tough time. Her counselor has recommended we have her evaluated for autism. After all this time, could that be it? She was always talking as a kid. She learned her numbers and letters early and would recite them obsessively. She read early. If she is diagnosed, what therapy would we look into?
That's awesome. That's so, and this might be very similar to the 16-year-old that we were talking about as well. This is what happens pretty frequently. I should write something about this because this happens so often that the child's basic skills are present, so no one detects the autism until it becomes problematic. So it's kind of like, I bet you this child has similar issues than that the other mom, who, by the way, we didn't even comment on how astute the other mom was, or the other dad who wrote, he doesn't have perspective taking, and
Yes.
that's pretty amazing to identify those issues. And I bet you it's a similar situation here. So what happens is the child has basic language, and none of these problems occur or become evident when they're younger. But as they get into more and more sophisticated age ranges, where friendships are based on a lot of, perspective taking, flexibility, inhibition of one's own thoughts and ideas. I mean, as teens, friendship is like a juggling act. Like, there's a million different things. You have to be aware of your friends' thoughts and desires, and at the same time you have to stand up for your own. At the same time you have to be able to handle bullies. It's an insane period of life, and it a lot of times, especially our girls, it shows up in their teen years. It shows up then. But some of the things you just told me are so typical of very, very intelligent young autistics, which is things like, she taught herself the alphabet and numbers or whatever very young, and she was routinely repeating them, that sort of stuff. That is all the brilliant side of autism, let's put it that way. And so, yes, I think that it would be probably important to get a diagnosis. Right now, her diagnosis would be ASD, probably with a very low severity, so 1-1. Maybe it might, even if she gets the diagnosis, but it would be important to do that. And then I think, depending on, again, it's very similar to the answer I gave earlier for the other individual, you would do some assessments that would help identify exactly where she needs help. So it's not like just saying, I want to, it's funny, it's like she has difficulty with no friends and change, very similar to the other individual. Yeah. But it's like, so it could be similar things, it could be different things. Like, maybe she has very good perspective taking, but she has an extreme level of anxiety in social situations because she's very sensory sensitive. I don't know. Could be that she's not sleeping well, and this is causing to her heightened level of anxiety. But there's some anxiety there because she's resistant to change, and she doesn't have friends. And in order to get there, in order to get to those bigger goals, you have to determine what are the areas that she's really needs to work on, right? And those are assessments. Like, that is only done through assessment. Now, we have a ridiculously long assessment called the skills assessment, which will identify those weaknesses for sure. It'll take a lot of time from you as a parent answering those, but that's on skills online. You can do that. But there are other assessments as well out there, like social skills tests, assessments of social skills, or even assessments that have to do with things like specifically focused on inhibition and similar to ADHD tests. There are specific tests. And so the people who either you can go online, you can actually these days, I mean, with all the AI that's out there, this is what I would do initially. I'd probably go to Claude and I would say, what are the assessments out there? I need to assess my child who is 16 and has these issues, or however old this child was. It 16, this one as well?
15. I think
15.
she's 15.
Yeah, I have these issues and I want to assess and determine what possible things are leading to the difficulty to have friends. And it'll ask you a ton of questions and you can answer all those questions. You can also ask it to give you psychologists who are near you who can do this kind of assessment. It helps with all of that. But I think it starts with assessing and determining exactly what the core skills are that need to be taught. Once those are taught, then it's a matter of putting it into practice. In your case, I don't know, because remember, again, with the other answer I was giving, content skills can be taught through ABA. If it's a matter of changing thoughts, because the thoughts are the ones that are causing her to fail, that's more cognitive behavior therapy. So it's sort of a combination of those. And I failed to mention something very important also for the other individual. Sometimes our anxiety becomes so high that we're not willing to put in the time and the effort or ever be exposed to that kind of situation because we just have such a heightened level of anxiety. Okay, so what happens in those scenarios? You should consult and potentially consider anti-anxiety medication, because everybody worries, a lot of people worry about giving their child medication, but let me tell you, it is 1,000 times more important for your child to have the right medication for anxiety than not. Because I am also, and I don't want to scare anyone, but I'm also on the other side of teenagers, very, very, very minimally affected teenagers who have not been helped medically, and their anxiety becomes depression and suicidal behavior. And it is important to give the individual all the support. And sometimes just ABA or cognitive behavior therapy on their own is not enough. And so you must do, every study in the world shows that a combined behavioral and medical is the most effective. So I just, depending on your individual child's situation, please assess. But if it's very, very severe at this point, also consider medical intervention.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.